you need. There's only one Morgan & Morgan for the people.
We're here at the Vegas Speedway for history's first race with cars that drive themselves. Intech Smart.
Tomorrow at 5 a.m.
I think it's hard to process what's actually happening right now, which is most people are going to get COVID.
Right now at 5, at the center of a COVID storm, the Omicron onslaught leaving hospitals short on staff and strapped with the sick, now forced to cancel surgeries. Why experts warn, forget stopping the spread. The focus should be on keeping our system afloat.
As a parent, I'm concerned and it's very scared.
Anxious parents return kids to class as COVID cases surge across SoCal. What's being done to keep students safe?
He had a promising future, a bright future that was taken away viciously.
Shot and killed while home shopping. A violent robbery claims the life of an off-duty LAPD officer. Several now in custody as police work to catch his killer. The news at 5 starts right now.
This is the KTLA 5 News at 5. I'm Cher Calvin.
And I'm Pedro Vera. Thank you for joining us. LA County has reached another grim milestone. More than 2 million confirmed COVID-19 cases since the start of the pandemic. The county reported more than 43,500 cases yesterday. Officials say nearly a quarter of those being tested are infected.
Well, at the same time, the number of people hospitalized with COVID-19 in the U.S. also hitting a record high, nearly doubling in the past 2 weeks. We have live team coverage on the COVID crisis. And we begin with KTLA's Jennifer McGraw with more on how the strain on hospitals are forcing them to cancel elective surgeries. Jen.
Yeah, Cher, here at Huntington Memorial, they have canceled those elective surgeries. They say those nurses need to help with the COVID patients. They say here there's more than 100, and it's not just hospitals, it's hospitals all across the region. With COVID cases surging across the country and in counties like Los Angeles, where the new positivity rates are shattering records, a startling warning comes from the FDA.
Most people are going to get COVID. All right, and what we need to do is make sure the hospitals can still function, transportation, other essential services are not disrupted while this happens.
Hospitals are overwhelmed, but not necessarily with patients, instead with a lack of healthcare workers who are out sick, which is why hospitals are starting to cancel elective surgeries.
This week we canceled, I think it was just a little under 50 cases. So that's about an average volume for us. So it was a lot of patients.
Methodist Hospital in Arcadia says there aren't enough nurses. In fact, they have over 100 employees out with COVID. The hospital is also struggling to staff ICU beds.
And it's not just surgeries, it could be colonoscopies, diagnostic procedures as well that can be postponed again without any detriment to the patient, but it frees up staff to take care of people who need care in the hospital.
By canceling non-emergency surgeries, the hospital is able to repurpose operating room nurses so they can help with COVID cases. Help is also coming from the state level. In addition to sending out the National Guard, the governor is looking for other ways to help hospitals that are overwhelmed.
We're hoping to contract an additional 1,250 outside staffing to bring into the state to help support this surge over the course of the next few weeks. So that's a top priority.
Okay, so Jennifer, what does this mean exactly for those patients who need treatment at area hospitals?
Staffing shortages, no doubt, but they say that they will still be able to treat patients here at Huntington Memorial. They say they do have adequate staff. Now, coming up at 6 o'clock, it's not just affecting hospitals, but also urgent cares. I spoke with one nurse practitioner who talks about their daily struggle. Live here in Pasadena, Jennifer McGraw, KTLA 5 News.
Jennifer, thank you. Governor Gavin Newsom wants to revive a supplemental paid leave law to help cover people who stay out of work while ill with COVID-19. California's initial supplemental paid sick leave law, it did expire at the end of September. It required employers with 26 or more employees to provide 80 hours of paid COVID-19 related sick leave. It was intended to keep potentially infected workers from returning before they were well enough. Students at LA Unified were back in class today, the first day since their winter break. Now, some schools had these long lines that you see here.